Record.
This meeting is being recorded.
Greetings and welcome to Mount Olympus. I am Hercules Invictus, and today on Voice of Olympus, I'm honored to be speaking with theurgist Tony Mierzwicki, and we are going to be exploring his system of exercise and how he addresses certain issues that men encounter as they progress through life in regards to their health. Greetings and welcome, Tony. How are you?
I'm doing really well, Hercules. Thank you so much for organizing this show today. I think that the topic that we're going to be discussing today is very important, and it's something that impacts every single man as they get older, once they get over a certain age, say over 40 or 50.
And I'm in my 60s now, so I'm sure if I haven't been through it before, I'm going through it now.
Well, it's going to be very, very important for someone in their 60s like you. So I'm going to be talking about the male menopause. So while it's less well known than the female menopause, the male menopause is real and presents many of the same symptoms. And there are also parallels in how it can be treated. So just summarizing the female menopause, menopause is the process through which a woman ceases to be fertile or menstruate. And for most women, it occurs between the ages of 45 and 55, but may occur as early as in the 30s or as late as in the 60s. And it happens as a result of estrogen and hormone levels dropping. Hormones are the most powerful substances in the human body. They impact our bodies and create more change than anything else that we have in our body. So very mild cases don't require any treatment at all. Cases with moderate symptoms can be treated with a combination of various herbs. But for more severe cases, they have to be treated with estrogen and possibly other drugs for symptomatic relief. So with the male menopause, which is also called andropause or viropause, it involves a drop in testosterone production in men who are roughly age 50. So some men develop depression, loss of sex drive, erectile dysfunction, and other physical and emotional symptoms when they reach their late 40s to early 50s. Other symptoms common in men this age are mood swings and irritability. Testosterone levels gradually decline through adulthood, about 1% a year after age 30 on average. By way of comparison, in women, ovulation ends and hormone production plummets during a relatively short period of time. According to Dr. Nosheen Ali, who's the bureau chief, ICN Madhya Pradesh, recognizable signs and symptoms of low testosterone levels may include, firstly, changes in sexual function. This might include reduced sexual desire, erectile dysfunction, fewer spontaneous erections, such as during sleep, and infertility. And also your testes may become smaller as well. Secondly, there are changes in sleep patterns. Sometimes low testosterone causes sleep disturbances such as insomnia or increased sleepiness. Thirdly, there's physical changes. So various physical changes are possible, including increased body fat, reduced muscle bulk and strength, and decreased bone density. Swollen or tender breasts, which are technically known as gynecomastia, and loss of body hair are possible. Rarely, you may experience hot flushes and have less energy. And lastly, she has emotional changes. So low testosterone might contribute to a decrease in motivation or self-confidence. You may feel sad or depressed or have trouble concentrating or remembering things. Now, there are a number of similar lists online, and a couple of these lists also include joint pain and low moods. So one thing that really stands out in this list is that Dr. Nosheen Ali included swollen or tender breasts or gynecomastia. Now, that is a classic symptom of elevated estrogen levels. So all the material that I saw online mentions low testosterone levels as being the cause of male menopause, but they consistently omit mentioning that elevated estrogen levels are also a feature of male menopause. So what men really need is a blood test. a blood test is the only certain way to diagnose a reduced testosterone level and an increased estrogen level. Some men have a lower than normal testosterone level without signs or symptoms, in which case no treatment is needed. So let's look at diet. Dr. Nasheen Ali suggests that male menopause can be treated naturally with diet. So she recommends two things. Firstly, she recommends eating more fruits and vegetables. That's always a good idea. And then secondly, she recommends choosing healthy fats. So she talks about monounsaturated fats and omega-3 fatty acids, which will help support a healthy heart and blood circulation. So monounsaturated fats, they occur naturally in olives and olive oil. And I'm assured that the best olives come from Greece.
Of course.
Of course.
Athena gave them to the Greeks and earned herself a city in the days of legend and lore.
Absolutely. So if you've got a choice of olive oil from various countries, always pick the Greek olive oil.
There you go.
So avocados are another food rich in monounsaturated fats and high in fiber and potassium and vitamin E. So a fun fact is that Florida avocados contain significantly less fat than California avocados, which are really creamy tasting. So that's something worth considering for those who are keeping their fat intake low. Personally, I'd rather keep my carbs low and grab the California avocados. But we all have to find out what diet works best for us.
That's very true. And avocados, I found that they sell them in frozen chunks now. I've been purchasing that and mixing it in with my protein shake. Every day I have one protein shake. So the avocado acts as a thickener, and if it's frozen, and this way I don't need to worry about having to eat it before it goes bad, because avocados go bad fairly quickly.
Oh,
They
I
get
haven't seen
brown.
those.
Yeah,
I mean,
they
that's fantastic because you buy an avocado and when you first get them, they're like a cannonball. They're,
yes.
they're so hard, and then within a couple of days, they're so soft you can't eat them. It's all in the lap of the gods. Having an avocado that's just perfect. So buying them frozen would be amazing. I will definitely be looking for those. Thanks for the heads up.
Is there a Target near you?
Yes.
That I get mine from Target. There are several brands. I found that the brand that we get in Target here is more readily available than the other brands in other stores, and it's less expensive by a couple of dollars per packet. So I'm a big fan of that type of frozen avocado.
Wow, thank you so much for the tip. Next trip to Target, I'm going to be looking for frozen avocados. Because the thing is that they're not available year round. I absolutely love them. Even just having them on their own with a bit of salt and a bit of pepper,
Mhm.
really fantastic. And avocado on toast is a staple for millennials. And what they charge for that in cafes is just unethical.
Yeah.
18 for avocado on toast when you can make it for yourself, at a fraction of the price. Anyway, so getting back on track, other sources of monounsaturated fatty acids include almonds, cashews, peanuts, and sesame seeds. Now, some people recommend canola oil, but personally I avoid it as it was derived from rapeseed oil in the 1970s. So it's not something that our ancestors grew up with, and much of what is sold is genetically engineered. Dr. Nasheen Ali also recommended omega-3 fatty acids. So they're found in flaxseed, hemp, soybean, and canola oils. I've already mentioned that I avoid canola oil. And the thing with soybean oil is that much of the stuff on the market is genetically modified.
Yes.
You have to ensure that you buy organic. Also, you can get omega-3 fatty acids from fish and fish oil and possibly other seafoods as well. Because I'm vegetarian, I stick to plant-based sources. I found a great article in Men's Journal, which is available online. So they talked about diet for boosting testosterone levels. And they said that a protein-rich diet may aid in a lot of testosterone boosting, according to recent health researchers. Another study has revealed low protein levels may damage the Leyden cells assigned to testosterone production. So increasing protein intake will support muscle development, which may be essential in testosterone boosting, and will help in fat loss, which is linked with testosterone. They also say that a carbohydrate-rich diet may bring out a rapid increase in testosterone levels, according to the latest research, but it may be harmful to diabetic people. So they particularly recommend carbs from starchy tubers, such as potatoes, yams, pumpkins, etc. Then they go on to say that a sufficient amount of healthy fats are important. And so they're actually very important for boosting testosterone levels. So you need to take in a sufficient amount of healthy fats. And they say that even saturated fats are beneficial. So in that respect, coconut oil is wonderful. I tend to use coconut oil for cooking. So summarizing, Men's Journal suggested adding the following foods daily to your routine. So firstly, there are lean proteins. Secondly, there are colorful fruits and green leafy vegetables. So that means leafy greens, broccoli, berries, carrots, and avocados. Then they recommended legumes and beans. Then they recommended nuts, seeds, and vegetable oils. And then they recommended whole grains. So, but the thing is that we all have to experiment and find the diet that works best for us. In my case, I found that as I've gotten older, I don't do very well with lots of carbs. So I tend to keep the carbs low and I let the fats come up. But other
Same with
people,
me.
yeah, it's just something I found. And before then, when I did have a lot of carbs in my diet, I then started to avoid gluten. So I was basically on a gluten-free, almost gluten-free diet, but still having high carbs. And then as I got older, I found that I should even drop that. So the thing is that obviously eating well will contribute to overall health and may well contribute to a tiny increase in testosterone, but I have trouble believing that very low testosterone levels can be restored to normality through diet alone. But obviously I'm a great believer in the importance of diet. So Men's Journal also recommended other factors in addition to diet. So firstly, there's exercise and lifting weights. Now, this is something that you and I both passionately agree with.
Yes.
So researchers found that heavy training like weightlifting may be the best way to boost testosterone. Lifting heavy weights may help gain muscle mass and likewise high testosterone levels. Exercise help in weight balancing and maintenance. Many studies have shown low testosterone levels are closely linked with obesity. In this era of COVID, a lot of people are coming to realize that you can't be obese. It's one of the conditions that presupposes you to contracting COVID. So getting leaner, getting healthier is extremely important. And obesity, there's a domino effect. If you're obese, it often leads to diabetes. It can lead to a plethora of health-related issues. So it's important to keep your weight down. We're not talking about having a six-pack, being absolutely shredded, but just getting the body weight down. So, and they also say that moderate cardio exercise can contribute to some extent as well, as they protect your heart and inhibit extra cortisol productions, which can negatively impact your muscle mass and testosterone levels. So they also talk about how important it is to curb stress, and they recommend meditation.
Yes.
So stress may affect some essential hormones like testosterone. Many researchers and physicians have shown some brain chemicals released in response to stress and anxiety, and then they might be transferred to the testosterone controlling sites in the brain. Other research shows that stress elevates the cortisol levels in the body. Cortisol is a stress hormone released by the adrenal glands in the kidneys when you are under stress. It is assigned with the management of numerous processes in the body, like metabolism and immune system. Therefore, increased cortisol impacts testosterone productions negatively. Meditation is a wonderful way of getting rid of stress. Researchers have found that at least 20 to 30 minutes of meditation per day will directly lower cortisol and increase your testosterone and growth hormone levels. Managing stressful situations is also important. And one technique that I was taught years ago is breath control. So when you get stressed, you start to breathe very, very quickly, and then that leads to even more stress. So by consciously controlling your breathing and slowing it down, you can reduce your stress levels in everyday situations. So very simple technique, but it's also incredibly important. Now, deep sleep is also very important. A lack of sleep can adversely affect the secretions and levels of many essential hormones and chemicals in the body, including testosterone. Long sleep elevates testosterone levels. Recent studies have disclosed that testosterone production is at its peak during the REM stage of your sleep. Many physicians also suggest that for a healthy testosterone level, around 7 to 9 hours of sleep are required. I can't remember the last time I got 9 hours of sleep. Usually for me, it's sort of more like 6 or 7, but hey.
In
Also,
my heyday, I used to get 4 hours of sleep when I had my TV show, and I did fine for years on 4 hours of sleep. It took me a while to get myself to sleep more hours. But yeah, I don't remember the last time I slept 9 hours either.
yeah, I can't function 4 hours. I can get by with 3 for a day or two. I can kind of minimally function on 5, but I do best with 6, I think. I couldn't survive like you did on 4 hours. I'd be a mess. The thing, your body rebuilds when you sleep. Your mind has a break. It's so important. The next recommendation is to avoid estrogen-like compounds. So we're talking about endocrine disruptors, which some of which are estrogen compounds. So we need to avoid BPA, parabens, and other chemicals. So it's all the more reason to buy wholesome organic food. You buy something that has organic on the label, and it's not going to have those nasty chemicals in it. It's all going to be natural. Some people also say to avoid soy, as it
Yes.
contains an estrogen-like compound. It's a plant sterol, while others are fine with it. So I think we all have to make up our own mind whether we're happy to have soy or not have it. And just on a related note, there are some people recommend that women should have soy, especially as they're approaching menopause, because it has this estrogen-like effect. So it sort of minimizes the effects of menopause. The next recommendation is to avoid alcohol and drugs. So they say excessive alcohol and drug consumption may have several adverse effects on your health and particularly on your liver. The body requires a lot of time to break down and process alcohol and drugs. So during this process, the liver does not get time to perform its other functions like breaking down hormones, including estrogen and testosterone. So in other words, if you consume alcohol regularly, your testosterone levels are lowered. On a related note, you should check any medications that you're taking for adverse drug interactions and the possibility of it containing an ingredient that lowers testosterone levels. And the last thing is that they say do not ignore your mental health. If you're stressed out, depressed, or mentally upset, your testosterone levels drop significantly. In such a case, a mental health professional should be consulted. I think that we can all do with a little bit of therapy. And that technique that I mentioned before about using your breath to control stress levels, that actually came from a therapist that I was seeing for a while back home. The thing is that a mental health professional won't cure you, but they will give you tools to help you navigate through life.
Hmm.
Yeah, when I was young, to admit that you were seeing a mental health professional was like an admission of failure. It was something that you were ashamed of, but things have changed. I mean, people are proud about
Yes, it's
seeking
fashionable now
therapy.
to seek therapy. It was a badge of honor for a while too. I remember I was in the mental health field for many years, for over three and a half
Oh, wow.
decades. I worked in psychiatric hospitals. I worked in outpatient programs. So I saw the changes in the field. And when you're a mental health worker, they encourage you to go to therapy because you're helping, other people. So they believe that you too should be undergoing the process In this way, you remain sensitive to the needs of others, and you remain respectful of whatever it is that the person coming to you for help is going through.
That makes sense. And the flip side that I've heard is that many mental health professionals have had mental health issues in the past. And so by getting therapy and seeing how beneficial that therapy was, they then feel motivated to pass that blessing on to others. And I think it is a blessing to give people tools to better navigate their way through life.
That it is, but like with anything else, certain tools work better with certain people, and like with anything else, some people become very enamored of a particular process, and then they try to convert people to the process rather than finding what works for them. Because like my psyche is very Jungian and Joseph Campbell-y, and yeah, reacted very well to Jungian and transpersonal types of therapies, because my internal landscape is mythic. But that's
Yeah.
not an approach that's going to work with most people who aren't swimming in archetypes.
That's actually very, very true. In the 80s, I had a very close friend who was a former psychiatric nurse, and she left the profession because while she was practicing, electric shock therapy was all the rage. And she said that she saw a number of patients who would appear to improve in the short term, but in the end, they all regressed.
Hmm.
And she said that in the 10 years that she was doing psych nursing, she never saw one patient improve on electric shock therapy, even though that was very widely used in Australia. She then became a homeopath, and she felt that even though it may take longer, she'd probably be able to cure people using homeopathy. But that's just an aside. But I totally agree with you that one modality of treatment may not work very well for other people. So the next thing I wanted to mention was natural testosterone boosters. I have a huge credibility issue with these. And over the last few decades, I have seen so many of them come and go, and none of them have stood the test of time. In the 1980s, there was sarsaparilla. Now, sarsaparilla has a sterol in it, which is a plant hormone, which is very, very similar in structure to testosterone. So what they were doing at the time was that they were telling people to take it sublingually, and then it would then legally convert to testosterone, and that you'd have these incredible gains while training in the gym. Now, I read an article back in the day that discredited the whole thing, and they said that yes, the sterol in sarsaparilla is very similar structurally to testosterone. However, you need two enzyme reactions to convert it to testosterone, and those enzymes do not occur in the human body. So basically, you can boatload sarsaparilla and it will do nothing for your testosterone levels. So the only people making gains were the people who were selling it. Yeah, so the fact is it doesn't work. In the 1990s, they were pushing tribulus, which is a Bulgarian herb. And I remember buying the seeds, and they're these horrible looking seeds with these spikes on them. I would put them into a coffee grinder and grind them up and then take the powder. It did nothing for me. And I did a quick search online. I couldn't find anyone who was still using tribulus. So the fact is, you have all these supplements coming onto the market, they're heavily promoted, and then they disappear. I have huge credibility issues with any sort of natural testosterone booster. The only thing that will boost your testosterone levels is a drug, HCG, human chorionic gonadotrophin, and that is extracted from the urine of pregnant mares. I'm not sure if they can chemically synthesize it or not, but in the gyms, people would only use it for 3 weeks at a time. So it would boost your testosterone levels for 3 weeks, but then, your body would have to, replenish the amount of testosterone that it had. So you'd have to use it in cycles. And the thing to remember is that if a supplement is powerful enough to significantly raise testosterone, it wouldn't be classified as a supplement, it will be classified as a drug. So I don't believe that anything that you buy in the supplement section of a supermarket will significantly raise your testosterone levels. You may get a small increase. So, I mentioned diet and all that before. I think that by having a healthy diet, you will do much better than having junk food 3 times a day. And if anyone is interested in the consequences of that, there's a wonderful movie called Super Size Me, where a guy
I
eats
remember that.
times a day. Yeah, it just shows how harmful junk food is to our body. I think, if you want to have it on a cheat day occasionally, yeah, why not? It's not going to kill you, but having it every day, not a good idea. You really need to have a decent diet. So you can see the parallels between the female menopause and the male menopause. So you can either do nothing, or you can take herbal supplements, or I feel that the only real way to significantly raise your testosterone levels is by actually taking testosterone. And the safest way to do this is to go to a doctor, get a blood test, and get a prescription. So, according to recent guidelines from the American Urological Association, the AUA, normal adult testosterone levels range from 250 to 1100 nanograms per deciliter, with an individual's testosterone level dropping slowly within this range beginning sometime after 30. So different laboratories may have slightly different normal values depending on the test method used. And as a rough rule of thumb, they say that a testosterone levels of 300 nanograms per deciliter is normal for a man, and a man with testosterone levels below 300 nanograms per deciliter should be diagnosed with low testosterone. In gyms, look, I move in different circles. I move amongst people who are fairly spiritual. I move in gym circles, but in gym circles, guys will talk about these issues. So
Yes.
what I'm about to say, comes from people who are using this sort of stuff, and they're more than happy to talk about it. You go to a spiritual type event, and no one talks about being on testosterone replacement therapy and how it affects them. You only get that sort of information in gyms. So in gyms, guys want their testosterone levels to be at the top end of the range. And someone who has a physical job or has a serious exercise regime will benefit from high testosterone levels. But if you have a sedentary life and you sit on a couch all day with a beer in one hand, a remote in the other hand, and snacks between your legs, then yeah, you probably will do well with levels around 300 nanograms per deciliter. But you will find that you are much stronger and you feel better if you have higher testosterone levels. So there are a number of ways of taking the testosterone. Some people have the patch prescribed to them by their doctor. I wouldn't recommend the patch. Look, I'm not a medical professional. This is just stuff that I've learned,
Right.
and you should discuss everything with your doctor. These are just things that I've learned over the years. So I wouldn't recommend the patch because you never really know how much is being absorbed by your body. And there's also a risk of transferring it to your partner. So you could have the patch on and you give a hug to your partner and they're going to absorb it as well. Now, if your partner is a male, not an issue. But if your partner is a female, you don't want her having virilizing effects. You don't want her sprouting chest hair and having a deeper voice and all the other nasty side effects that come from women taking testosterone. The route that most people in gyms use is with injections. So typically your doctor might prescribe testosterone cypionate or testosterone enanthate or sustanon. So they're basically different esters. So cypionate lasts about a week in the body, enanthate lasts about 5 days in the body, whereas sustanon contains 4 different esters. You have one which is a very short-term ester, you've got one which is a very long-term ester, and you've got 2 that are somewhere in between. So the theory behind it is you shoot it up, you get, it hits your system rapidly, and it lasts for anything up to a month.
Hmm.
So, I mean, that's another option as well. So the thing is that by injecting, you're being gentle to your liver because it's absorbed very, very slowly, and you know exactly how much you're getting. Now, there's also a possibility of taking oral testosterone. And recently, there were testosterone under counterweight soft gel capsules, which have been which have been approved for testosterone replacement therapy. And testosterone under counterweight can also be taken as an injection, but I don't think it's legally available as an injection in this country, but it is available as an oral. So testosterone is gentle on the liver, but there would be a slight strain by taking an oral. But if you're on a very clean diet, then you could probably get away with it. Some people can't handle the idea of regular injections, so that could be an option for them.
Alternative. Yeah.
Yeah. Now, the last option that I'm aware of is testosterone pellet implants. So that involves a 30-minute office procedure, and you have pellets implanted into your body, and those pellets will last 3 to 4 months in most cases. And these have been used since the late 1930s and are apparently one of the longest and safest forms of bioidentical testosterone replacement therapies for men and also for women. Some women are actually taking testosterone these days as well. A few decades ago, women avoided testosterone. Now, there are some who will take small amounts, but finding a doctor who will give it to them is another matter. I personally don't know of anyone who has had testosterone implants. Everyone I know
Nor
just
do I. This is the first time even learning about this procedure.
yeah. Well, it's been around since the late 1930s. But I think for those people who can't be bothered getting injections, and so you get the implant done and you're set for 3 or 4 months. You've got a slight elevation in testosterone levels. You're feeling a lot better. I mean, testosterone is what makes us men. You feel so much better when you take it. And this is the thing, with every guy who I've spoken to who's gone on testosterone replacement therapy, not one has said, oh, that was a bad idea, I'm never doing that again. Everyone has said, damn, I wish I'd started that years ago. So I'm going to give a couple of examples from, without mentioning names. I've got one friend in his mid 60s, and he said that before starting on testosterone therapy, he would finish his workout and then he'd stumble out to the parking lot, and he would just sit there in the car and he'd be feeling really tired. Now, after he started taking testosterone replacement therapy, he is lifting more weight, has more energy in the gym, does more sets, goes out to the parking lot and thinks, damn, I could have done some more sets. So for him, it's made an absolutely huge difference. There is the option of not taking anything. So I've got two friends who do not take anything, only two. One is a white guy, he's a retired attorney, and for some reason, he has naturally high testosterone levels. And fairly lean. He's fairly lean, muscular, and strong. The other guy is an African American guy. So the first guy, the attorney, I think he's in his mid 60s. The African American guy is in his 70s, and he is strong as a bull. He's stronger than I am, and he's never taken anything. And I mean, I only see these guys in clothes, but they look pretty damn good. It's not like they've got these guts hanging out of them or anything else. And they do not need to take anything. But then on the flip side, there was a guy I was talking to who refuses to take testosterone. I was talking to him about testosterone replacement therapy, and he basically has the figure of a middle-aged matronly woman. So you look at him, he's got the big hips, he's got the man boobs. So you're looking at him, you know that he has low testosterone levels and high estrogen. And I asked him if he'd ever thought about going to the doctor and having things prescribed to him. And his answer floored me. He said to me, if the good Lord saw fit to drop my testosterone and increase my estrogen, then I'm fine with that. I had no comeback. I just did not know what to say. But then,
No, what can you say?
well, there's nothing. But then I thought about it afterwards, and I thought, well, if the good Lord saw fit to give him a defective pancreas that doesn't make enough insulin, so that leads to type 1 diabetes, would he be fine to die, or would he inject insulin? Or if the good Lord saw fit to give him a defective thyroid, would he take thyroxine or get very sick? Or if the good Lord saw fit to give him a defective heart, would he get a pacemaker or would he die? You know, it makes no sense. That the fact is that we have, we're living longer than our ancestors did. And so a lot of us are coming down with conditions that wouldn't strike down our ancestors because we're a lot older. And
Right.
modern medicine is absolutely wonderful. It enables us to treat various sorts of conditions and give us optimal health. Now, the thing is that with testosterone replacement therapy, what you're doing is you're basically getting your testosterone levels back to where they were in your mid-20s when you were feeling virile and strong and everything else. And as I mentioned before, some guys have elevated estrogen levels as well. And the easiest way to tell is if you're starting to get fatty tissue coming up underneath your nipples, well, by then it's probably too late. But you know, if you start to get a little bit of nipple sensitivity, you know that you've got elevated estrogen levels, so you need to get on top of that. There are a number of drugs that can be used to lower estrogen levels. The drug of choice appears to be Arimidex. So that will drop your estrogen levels and you will look and feel better on it. But the thing is that if you're training in a gym, you're eating well, you're training hard, if your testosterone levels are low, you will not be getting optimal results. You're basically wasting it. Well, not wasting your time, but you're not using your time as effectively as you could be. So, I mean, this is something that testosterone therapy is starting to become more mainstream. A few decades ago, no one talked about it. Testosterone was thought of as evil. And I started noticing over a decade ago that there were advertisements on TV and on radio. They were talking about how men will benefit from testosterone therapy. And I don't want to recommend a particular shop, but I remember when I had some testosterone prescribed to me, I first contacted Costco. Now, as you know, with drugs, quite often you ring up the pharmacy and you say, hey, I'm going to need such and such a drug. And they'll say, okay, we'll get that in next week for you. We'll ring you when it comes in.
Right.
So I rang up my local Costco and I said I needed some testosterone cypionate. And they said, fine, just come down. They had it in stock, which means that it's an
It's in
item.
use.
Yeah, it means that they have a lot of it in stock because a lot of guys are using it. So all those guys you see in Costco wearing their cargo shorts and their Hawaiian shirts, which seems to be a standard Costco uniform here in California, they're all shooting up testosterone. So they had the testosterone there. They had a box full of needles for me. You know, they had literally everything that I needed. It has gone totally mainstream. And just going off on a bit of a tangent, a few years ago, studies indicated that by taking testosterone, you were endangering your prostate. You could get prostate cancer or prostate enlargement at the very least. But a decade or so ago, there was more research that pointed out that prostate enlargement, prostate cancer occur in men who are older. It doesn't occur in younger men. So this research was strongly suggesting that by elevating your testosterone levels, you were protecting your prostate.
Hmm.
So like I said, apart from those three guys, as far as I know, everyone in my current gym and in previous gyms, once they hit their mid 40s or 50, they're all doing testosterone replacement therapy. And just repeating myself, not one of them has said that this is a bad idea. Everyone benefits from it. And you know, you hear other reports of guys saying that all of a sudden they're waking up with morning wood, and they hadn't done that in years. So they're feeling much happier. So this probably isn't politically correct, but it enables you to feel like a man.
I experiment with a lot of different things, and vitamins. I've always had a kind of like a love-hate relationship with vitamins because I'll cycle through them. So
Hmm.
I'll take a vitamin, then I'll stop taking it. And the only things I notice if I stop taking them, it has an effect, are lutein for my eyes.
Wow.
Uh, like Ocuvite 50 plus I use. If I stop taking if I stop taking that, my vision becomes blurry. And then if I start taking it again, my vision clears up and becomes a lot less blurry. But that's one of the only things that I noticed. If I stop taking it, there's an effect, or if I start taking it, there's an effect. A lot of the other vitamins, and I experiment with a lot of different vitamins, I can't tell, if there's an effect or not. If I stop taking for a month, or if I start taking for a month. Creatine seems to have an effect. Um,
Creatine is one of the few supplements that has stood the test of time. It volumizes the muscle, it increases the size, and it's still available now. I've
yes,
mentioned over the last few decades, I've seen so many supplements come and go, and creatine is one of the few that's been around. The other one is just protein powder. In the 70s, there were two forms of protein powder. The the one which was considered to be top shelf was milk and egg protein,
milk and egg. Yes.
and then you had uh, soy protein, which was considered to be a very inferior form of protein. And those are the only two that you were able to get. And then after that, they started moving to egg white protein, because there are all these studies that indicated that egg white protein was the best protein for you.
Higher bioavailability. Yeah, I remember.
Yeah, my understanding is that those tests were done on rats, which suggests that egg white protein is the best protein for rats, but it may not necessarily be the best protein for humans. And then after that, they started moving towards whey protein, which
Hmm.
is a milk derivative. It's a byproduct of cheese production. When you make cheese, you have the curds and the whey. The curds become the cheese, and the whey used to be discarded. I remember back in Australia, they started selling whey in combination with various juices, so you could actually drink a little bit of whey. And then after that, they started extracting protein from the whey, and that protein was supposed to be more effective than normal milk protein.
I
So
have, because of my diabetes, whey was not good for me. Whey elevated my blood sugar, and I started having reactions to the whey, in terms of just like tiredness and fatigue, which sometimes happens if I'm eating things that affect my diabetes. And casein. Casein gave me terrible gastrointestinal problems. I don't know why, but it did. I cycled on and off of it like 3 times, and each time I was on the casein, I had very bad gastrointestinal problems. So casein and whey are off my list. Soy protein isolates. Again, I'm not a doctor and I'm not a nutritionist, but the research that I read tended to indicate that in addition to being bioengineered, a lot of people were having difficulty with the soy protein isolates, and also soy with the estrogen issue, which you had
yeah,
brought up. So that made it off my list of things to play with. Also, I stick now a lot with, there's a brand called Sun Warrior. It's
yeah,
a total vegan protein, and I've been very happy with that. I tried different versions of it, and the one that's just the vanilla protein seems to agree the most with my system, and give me a good amount of protein without affecting my blood sugar level. So lately I've been pretty much sticking exclusively to it. I used to experiment with different proteins like coconut protein and other hemp protein. And again, I couldn't tell any result if I took them or if I didn't take them. But the Sun Warrior, I seem to feel better after I've taken it, and it seems to give me a sustained amount of energy, and I don't have the problems I've had when I've cut down my protein to experiment with that aspect of my diet as well.
Yeah. Sun Warrior is one of the top end vegan proteins. It's very pricey. I have had it. I've really liked it. Sometimes my budget doesn't extend that far, so I will go for a cheaper protein. I do well with pea proteins. Pea
Hmm.
proteins are very, very popular at the moment. I have taken hemp protein before, but for me, the issue was taste. I just didn't like the taste of hemp protein. And the other protein that's absolutely horrible is rice protein. If you ever have rice protein on its own, I just gag on it. It doesn't matter if they add vanilla or chocolate to it. It's still
My
horrible.
diabetes spiked on rice protein, shot my sugar right up.
Oh,
So it's like
wow.
bye bye rice
Interesting.
protein.
You can also buy protein blends. So I've had rice protein with pea protein, and it's not too bad that way. Yeah, a few years ago, they had this idea of complementary proteins because
Hmm.
they say that plant proteins are complete. But if you combine a legume with a grain, then all of a sudden you're getting a complete protein profile. So by mixing pea protein with rice protein, you're getting that complete amino acid profile. I think that in Sun Warrior protein, you've got, from memory, they have a mixture of different protein sources.
Yes.
And I think that's very important if you're sticking to plant-based proteins. But I would encourage everyone to do what you did, to play around with different proteins until you find one that really agrees with you. I mean, I'm taking so much protein. If I was only having a little bit of protein, I'd probably be doing Sun Warrior as well. Isn't that the brand where they talk about the energetic properties of it as well?
I don't remember. It's been a while since I'm familiar with the product now, so I don't remember what I read about it. But I remember trying it. I liked the taste. That was the first good thing
Yeah,
about it. And then I started researching the ingredients. I'd gotten it on. I think the first one I got on sale in my local health food store, and now I order it primarily through Amazon, or there's another vitamin shop, I think, that delivers to your door.
yeah.
So I go through one or two of those a month, the
Oh,
big ones of
yeah.
protein. So again, depending on what my budget happens to be at a particular time, I'll get them delivered, or I'll stop the delivery and pick one up whenever I need it. And I limit myself to one a day because I'm very busy, and it's tempting to have like shakes all day.
Yeah.
It's not healthy either. So I limit myself to one shake per day. Occasionally, if I've been busy all day and I haven't had a chance to eat, I'll have a second shake. But not too many problems with the Sun Warrior. And the ingredients, I haven't found any bad information on it. I Google it occasionally, like I do with everything that I take. And nothing bad has really come up in all my searches. I searched it recently, like a week ago again.
Yeah. I normally have 2 or 3 shakes a day. So I mean, so it starts to become a little bit expensive. If your budget doesn't extend to Sun Warrior, All Gain is really good. It's organic and it tastes good. I think if you're having a lot of protein powder, it's part of your daily regimen. Taste is really, really important.
Yes.
Um, Vega is considered to be equivalent to All Gain, but there was a study a few years ago where they found excessively high levels of
Metal,
heavy metals. Yeah,
metal,
with
yeah.
Vega. So after that, it was being sold off cheaply everywhere because no one wanted to use the stuff. But all gains a good one. But we have a discount grocery store here, and so I basically go in and see whatever vegan protein is on sale and grab that. So it is possible to do this on a budget.
Yeah.
If if you have an unlimited budget, then there are all sorts of amazing high-end vegan protein powders. And I can't remember if it was Sun Warrior or not, but there was one where they were talking about how they didn't just look at the nutritional content, but they looked at the energetic properties of it as well. So they were trying to tap into the new age market where people want to take something that's going to boost their energetic levels. You know, we're not talking about having energy to get through your workout. We're talking body energy, that sort of thing. So there are all sorts of products out there that you can play around with.
Yeah, there are, and again, I'll experiment with things. Like I remember when horny goat weed was the thing, and you said the tribulus, and there were all sorts of things over the years. And again, I'll experiment with it. Like when I was younger, zinc was the thing you took to give you that extra vitality or that extra testosterone boost. So you know, I'll experiment with them, but so far, like you said, nothing. You know, it seems to be effective. It just seems to be hype. And with Michael Del Rusi, we actually did a show about this like a year ago, how just all that stuff to most people who are serious about taking things have reported the same, that there's no, you know, no discernible results, that it's just a waste of, you know, money, you know, to take these supplements.
Exactly. I hope this doesn't get me into trouble, but there are all sorts of advertisement that you'll see online of these well-built muscular guys, and they'll be telling you that it's a matter of following their exercise regimen and taking various nutritional supplements or modifying their diet, and you can look like them. And I'm looking at them and thinking, no, I mean, you're not natural. You're shooting stuff up. I also remember seeing much the same sort of thing at a fitness convention that I went to. There were all these guys in the audience who were lean. They looked pretty good. They were, you know, in their 50s, say 50s and 60s. And then you'd see the guy up on stage, and he was basically pushing his method of training, the supplements he takes and diet and everything else. And yet his muscles were significantly bigger than the guys in the audience. And yet my intuition was telling me, no, he's supplementing with testosterone anyways, which is, it's a little bit dishonest to take something and then claim that all the benefits that you're obtaining are solely from your diet and various supplements that you're taking. I mean, why not just be honest? So
I agree with you.
yeah, I find it refreshing that, you know, with the guys in the gym, it's like, yeah, I've been on testosterone replacement therapy for years, and, you know, it keeps me going and everything else. Why not be honest about it? Because at the end of the day, you know, I pointed out that testosterone levels drop by 1% on average every year after you hit 30. So by the time you get to your 50s and 60s, there is a significant drop. So all you're doing is you're taking a little bit to boost your levels, to get them back up to where you were in your mid-20s. So you have more energy, more drive, you function better in the gym, you function better in the bedroom. It makes you more of a man.
When I was younger, one of my catchphrases that I used was "testosterone is my god." Uh, so unfortunately, we're running out of time. But before we close, I want to thank you for broaching this subject, because it's an important subject. We are living longer, and you know, we change as we move through time. I found that it's very dishonest the way certain things are advertised now. And in fact, in my Nemean Lion group, which focuses on my quest for mythic physique, I posted a bunch of YouTube videos showing two things recently. One, that you can make the before and after pictures are deceptive, because with proper lighting and tanning oil and pumping quickly, you can take a before and after picture that are significant, you know, enough to be put in a magazine in like 5-6 hours, you know, so that those pictures are very deceptive. And some people have even done it backwards. They went from having that physique showing themselves in a dumpy physique, so they can make a before picture that was actually an after picture. So there's enough showing you how that illusion works. And then also the I eat chicken and broccoli and brown rice and and that type of stuff, that it's misleading too, because these guys are on a steroid regimen, and it's very clear if you know what to look for if someone's on a steroid regimen. And although they couldn't vouch for every single person being on one, maybe they had exceptional genetics. For most of the indications are that no, that's not how they're getting in shape like this in a few months, and they do this especially with Hollywood actors. So because it's important, like I'm a lifelong lifter like you. So I know that it takes a long time to see, results, and that, you're not going to look like the guys in the magazine unless you do certain things. And if you don't want to do them, then you just have to accept that you're not going to look like that ever. And so I wanted to make sure people understood that too, going on this road, that basically don't believe these lies, because it'll lead to disappointment and disheartenment, and you'll give up, and that's not good.
Absolutely. And just further to what you were saying, I stumbled across a YouTube video a few months ago where they dealt with that very subject. They had interviews with a number of Hollywood stars who got into shape very quickly. And every single one of them was saying they did it on chicken and broccoli and hard training. It's like, no, there was, there are injections happening there as well, but they won't admit to that.
Right.
Yeah, I like honesty and transparency. And we both agree that as we get older, changes take place. We're living a lot longer. So we're tackling issues that our ancestors didn't have to deal with.
Never had to deal with.
Yeah, because we are living longer. But I think it is important to sort of be honest about this sort of stuff.
I believe that also. It is very important to be honest, and just in terms of so people can know what to really expect, because a lot of people buy into hype in a very many areas in our life, and then they hold that up as a mirror in terms of what they should be seeing in their own life, and chances are they're not going to see that, and then it leads to all sorts of negative and sometimes dangerous thoughts, and self-esteem issues. And again, why not just be honest? Basically, this is what you do to get these type of results, and if you want to look like that, you're going to have to risk, certain things to get that way.
Oh, and there's one more thing I have to add. I should have said this before. A lot of people have this preconception that if they shoot up testosterone or a similar sort of steroid, they're going to turn into Mr. Olympia overnight. That
Right.
doesn't happen. It is just a tool that will help you get there. You still need to have a very strict diet. You need to be training very hard. You need to give yourself a lot of rest and recuperation time. So there are a lot of factors that come in. So yeah, sure, those, and with the Hollywood actors we were talking about, they probably were eating chicken and broccoli. They probably were training as long as they said, but there are injections there as well. They
Right.
worked hard for what they got. But the thing is, without that missing testosterone ingredient, they would not have gotten the sort of results that we see. And the thing is that there is an expectation that if you're playing an action star, you have to look good. When your clothes come off in a scene, you have to look good. Those guys have to. If the clothes come off and they've got a huge beer gut, it doesn't work. There was
Right.
one of the Thor movies where Chris Helm, I think his name is, who plays Thor. He
Chris
actually wore he actually wore a bodysuit to make it look like he had a pot belly. He looked horrible. Fortunately, it was a bodysuit, but the guy does look really good when he takes his gear off. You got to give him credit. So he
Yes.
is trying hard, but I'm pretty sure there's a bit of assistance there as well, unless he's a genetic elite. That is possible, but we're talking a tiny percentage of people who may not need supplementation. But the average guy in the gym, they're all supplementing. They're all on testosterone replacement therapy.
And on that note, what do you call it? We'll wrap up for there. But this is a to be continued, and you brought up certain issues that I would have liked to touch on if we had more time. One of the things I'm doing recently is I'm introducing pranayama and other energy techniques into my my daily workouts, because I work out with weights. They're not as heavy as they used to be once upon a time, but I do weights every day for the most part. Occasionally I'll miss a day, but I aim for every day. and for like an hour plus a day. But lately, especially with the diabetes, I have like peripheral neuropathy, like on my hands and my legs. So I used to be able to do a lot of energy exercises when I was younger, and I'm finding that now I'm having a little bit of difficulty with them. So I've been increasing the time that I've been spending with them. And you had mentioned breath work
Mhm.
and energy. So I'd like to focus on that another time. I'll share what I've been doing, and I'd like to learn what you're doing as well.
It sounds like you need an anti-inflammatory there as well. Like you need a little bit of glucosamine for your joints. You need a little bit of MSM for your connective tissue, your tendons and ligaments, and you need an anti-inflammatory as well. CBD oil would be wonderful. So you'd benefit from that as well. By all means, do the pranayama. I think the more things that you do, the more effective your results are going to be. But supplementation becomes more and more important as we get older.
Yeah. Well, thank you so very much, Tony. As always, I enjoy the time we have together, and I really learned a lot from this conversation, and to be continued.
To be continued. Have a great day, Hercules. Take care.
You too. Take care. And everyone who tuned in later on, because we're not live on YouTube, thank you for tuning in. Soon I should start saying, if you like this video, click on like and things like that. So I'll get a script together. We'll eventually add that. Have a great day, everybody.
Thank you. Bye.